Greetings folks, Dr. Karandish, PCH MedSpa. We are here with a beautiful model which we're going to do the Morpheus8, and we're going to show you how to trim the jawline and also destroy the little submental fat. She's 26. This submental area bothers her. It's a little stubborn area that obviously in her case is more of a genetic, and I'm sure her family members also have it, but she wants to attack it sooner than later. So she's done some secret RF, skin tightening, and then she also did a mini liposuction of the submental area, and she comes to me, says, it's not how I like it still. So I offered her Acnes RF, which is that machine right there. And then we also offered the Morpheus8 because of her modeling and shooting and all that type of involvements that she has. I thought a smaller downtime makes sense for her. So we decided on Morpheus8. We topically numbed her for about 45 minutes. We gave her the option to do injectable lidocaine with epi to make it easier, but she opted out. So we're just gonna try this and see how it goes. And we thought we're gonna make this a little educational video for the Morpheus, because Morpheus is a very versatile machine, as I will explain to some extent, that what we can do with this machine where we don't have this versatility with other machines in that category. We're gonna clean the skin. She's all nice and numb. Her pain tolerance is good. Always a good idea to ask your patient what's your pain tolerance when you go to the dentist, how painful it is, and this and that. Obviously, for ladies, it is important to know what day are they in their monthly cycle, because based on the hormones, the pain tolerance is different, and that's important. That's important. Sometimes during some stages, you're just more sensitive because of the balance of estrogen and progesterone in your body, and so forth. Just a little note for the practitioners who might be watching this video. Perfect, good. So that's nice and clean. We're gonna do a little bit of chlorhexidine mixed with alcohol just to clean this really nice. This is not a sterile procedure, but we're gonna treat everything as a very clean procedure. And I told her if you don't get all the blast with Morpheus, then the next option obviously is secret RF, and if you want to even go a little bit crazier, we can do the face tag, which I thought is a little bit of overkill. Let's start our treatment. Sometimes we can do a little vibration tool to kind of distract our patient, but let's see how she does. This is my first time doing any procedure. I did some Botox for a couple weeks ago. So chin up here, okay? So this area, we have loose skin, all right? And we also have some small amounts of fat, which is sometimes difficult to remove with lipo because it's a small amount. So these minimalistic procedures usually work better for somebody at her age, in her mid-20s. We're gonna give her a little feel of this. It's gonna be 2-3 seconds for each shot, okay? So here we go. Okay, how was that for you?
Really easy.
Mm-hmm. So from 1 to 10, what was your pain level?
1,
okay,
2,
perfect.
maybe.
Okay. I'm gonna do another round here. Now this is the fixed mode that Morpheus offers, and you don't have this with other machines, because with this mode the needle goes in to the depth that we have chosen and actually destroys some fat and causes coagulation and ablation of the skin. We are a little bit deeper, and we're not going to go too lateral, but we're going to stay in this area. And when you hear the beeps going, and this machine actually has a little vibration that me and Kelly will appreciate, that means we're in the right plane. When we don't have that much vibration, means we're too, there's not much of fat, and it's more just like superficial skin. So that guides us based on the vibration. You feel the vibration?
Mm-hmm.
Perfect. Now she's tolerating very well. We don't see any bruising or anything, so we can always go up a little bit. So I go to the deepest form here, and then my energy, I'm gonna up it. This is the fixed mode, and that's it. So we're gonna go one step higher. You're not gonna feel much worse, trust me, okay? So here we go. Deep breath, out. You okay?
Mm-hmm.
Good, so she's tolerating very well. You feel the vibration?
Mm-hmm.
Yeah. Okay, give her a little break.
Oof.
I'm gonna clean up a little bit. She's still not bruising, just a little tiny bit of pinpoint bleeding, which is very expected with this procedure.
Yeah.
So that was really the most intense part of the procedure. And you know, now her fear level is lower because you know what she's dealing with. We numbed her pretty good. She's happy. She's smiling and laughing. So this is just a good recipe for a good procedure for Morpheus, because you need to control your patient's pain. Okay, so usually we do a few rounds of this. Again, this is the deepest level. Energy is pretty nice and high. So at this energy, I can really do fat trimming, which is very unique to this machine. We can kind of mark our jawline here. A little bit of jawline enhancement is what we can do with.
Oh, I love that.
Exactly. So for that, usually we do the lower and then we go do the upper. But for the upper, I don't think she needs it if we just really tighten
Get the
this
lower.
area. Exactly. So our area of focus is really under the jawline today, and we're gonna get, obviously, as you folks know, the results are gonna be in 4 to 6 weeks. The younger the patient, the results will be quicker. Okay, just like when Kaylee has a cut and then I have a cut, she's gonna heal much quicker than she's younger, 20 years almost. So, so there's my age. Anyway, so here we go. We're gonna do another round of this and see how this goes. Obviously, the younger your patient is, you're gonna get better results with this. So it's no brainer. Is it pretty painful on that side?
A little more.
Okay, a little more, but you still
But
have
not
some.
that bad.
You have some fat there. That's the reason I asked. Okay, chin up, Kaylee. Perfect. You always want the skin stretched a little bit, folks. The chance of fibrosis and granuloma, either you do Morpheus or face tag, which I do a lot. I do a couple of them at least every week. Is much less when you have the skin nice and pulled. Okay, so that was our second pass. You see more redness, but still this is very doable. And I'm just going to show you. This is Corey. So this is when I press, the needle goes in and that stays. See? So the needle stays inside, so it keeps delivering energy. Now this really is what does the magic. So I'm going to do one more round
Okay.
with a little bit higher energy since you're tolerating, and then we're going to go do the fluffier part.
Okay.
Okay.
Very cool.
Perfect. So chin up again. Good. Always want a nice visualization of the skin. You will see a little tiny burns at the superficial. That's very normal. This is going to be gone by tomorrow. Do not be worried if you guys see this, the providers. So again, you can also squeeze the fat out, but she doesn't have much. So and I'm just going to stretch the skin and kind of go deep. I'm going to hold it longer because the chance that there's more fat tissue in the middle is always more, and she can tolerate because there is some fat. So we just really blasted up. That hurt a little bit because it was on your bones. It was my bad. Perfect. Okay, guys. So we've done about 300 clicks already. Yeah, 302 just by the fixed mode, which is very nice to start, and definitely she will see the results.
Yeah, it really wasn't that bad.
Beautiful. Good to hear that.
Definitely like more by the the jawline.
Excellent. Good. So we're gonna go a little bit more superficial, and still we're gonna reach some of the fat, but also skin tightening. So in the middle you have more vibration. This is like a genius of this machine that will tell us where to go and where not to go. Okay, so that's another round of 3. Now since she wants a little bit more jawline, we're gonna carefully
This
go
is
right
weird.
under the jawline. Yeah, but you know, we're gonna just do a tiny bit, so don't move, and chin a little higher. Perfect. Normally, whatever I do on one side, I do the same exact on the other, so we make it exactly symmetric. And we don't miss any areas, make sure we deliver very symmetric treatment. Okay, so I just did 3 passes of that setting, and we're gonna do the same exact thing on this side, Corey. Here we go. So you notice I go a little bit faster because my intention really is to do more of skin tightening. So we're not trimming a lot of fat here, but it's a little bit more superficial. Perfect. That's our 3-pass right there. Looks good. She's gonna have a little bruising and all that. She's gonna expect this. We already talked about it. And she's gonna be cool with that. It's gonna be gone in 2 days. So that downtime really is 2 days, even with the most intense treatment.
And you can put like arnica on it?
Absolutely, yes. So we're gonna do a little bit down here, just maybe 2 passes. Because when you tighten the skin, even in the lower parts, guess what happens? Everything gets nice and tight. One pass, and then I go right back on it, right? That gives me 2 passes. All right, that's 2 passes right there. And when you tighten the skin here, also this will get a little tighter because obviously the skin's all connected. So when you tighten this whole thing will be pulled down. In my thread patients, sometimes people come for neck, and what we do, we go from here. That's my signature technique. We put a thread this way up, so we enhance the jawline. But look at the neck when I go like that. The neck also gets better. So it's a little trick for people who do threads. Anyhow. We're gonna go to a little bit fluffier treatment, but still we're at the fixed mode, Corey, here, so a little bit lower energy. That's just
so fluffier means like easier?
Superficial.
Oh, okay.
Oh, easier, yes. Easier, though, doesn't fluffier or superficial doesn't mean less pain. Because pain receptors are more at the surface.
Okay.
So that's important to know. But for you, yeah, we can say easier. Less energy for sure, which is important because the energy does also burn a little bit. So we are at 2, so we're going to do a different depth, just 2 passes again. The beauty of today's session is we're just focusing on this area. So, and you can see we don't have as much vibration because this is it's better in the middle. So that's a good guide that it's time to switch gear. Okay, so what's been your pain so far from 1 to 10 at the worst?
Worst, I would say 3. Like you can definitely sit through it.
Okay. So that's pretty good for
It's definitely like more by the bone. You can
by
feel
the bone,
more, obviously,
exactly.
but.
So by the bone, we usually go do the single, which we're gonna start now. So chin up again there, perfect, good. We're gonna do more of a superficial treatment, but this is a glorified microneedling, but obviously much more effective because you're also delivering energy and you're doing the skin tightening. It's really what she needs also. So it's important to cover both sides of this treatment. With Morpheus, I kind of like to push my feet on the pedal and just go non-stop because it's easier for the patient mentally. Yeah. Exactly. So it's going to be a quicker treatment time. Usually that helps. And we give sometimes a little break right there. Perfect. Okay, good. So that was that. And then we're going to do another round and I go to the most superficial part of the treatment. So here we go. And then for the very first treatment, we really don't spend our 100% because we have to get a feel of patient's response, how quickly she recovers, what was her downtime, right, folks? So that's important. I don't do my biggest procedure the first time I'm dealing with a new patient. I usually reserve that for second or third time once I get a better feel of my patient. Obviously, when you have a healthy younger patient, you can be a little bit more liberal with your treatment, but still, especially people who are on social media and production, modeling, and that type of business. So that's our third pass there, maybe fourth one actually. Good, so she sat through this like a champion. We should play the Queen's Champion for her. She's doing great. Okay, now we go a little fluffier. This is definitely at the microneedling level, so there we go. Good. Okay. So it's gonna be nice and quick. How's that, okay?
Fine.
Good.
Yeah.
So now we're just treating skin, guys, and doing the skin tightening as its best. We covered all these different depths, so that's important for our patients to understand really how this machine works and what it can do. After we're done with this, we will apply exosome. Exosomes are little tiny proteins that communicate between your stem cells, and it's a topical application, FDA approved. You can inject it, but it's really FDA approved for topical. And when you have millions of little holes in your skin, guess what? That's the best time to apply your exosome. So she's gonna be getting some exosome. And then her next treatment is gonna be in a couple of weeks. If the patient is older, 4 to 6 weeks. 700 plus flicks. The whole thing was what, 20 minutes?
Yeah.
Her pain was 2 or 3 out of 10. As you can see, she can probably go to a party tonight. She's not really tiny bruise there, but you know, with her complexion, this is
Normal.
totally acceptable. And we use the Exo-E product. This is a synthetic exosome. This is a topical application, folks. So my patient really doesn't need anything else. We just put the exosome and we send them home with this, and we ask them not to wash or touch the area for 12 hours or maybe until the next morning. So this gets really absorbed and stays. So you don't want this to be washed. You will do a lot of manual massage, and you have to do harder massage. All right, folks. I hope that video was educational for providers and also some patients around the globe. And thank you, Kaylee, for modeling for this. Normally, we do this treatment a couple of times, the Morpheus, and then after, if we need to go to a bigger gun, we can do the Agnes. We can do the face tight. This is one of my favorite machines. Also attaches to the same Genius InMode from Israel. And we make insertion here, here, and here. And this goes under the skin. Obviously, we put tumescent and numb the area.
Yeah.
And yes, and we iron the skin. So it's basically the next level for people under age 30. I think it's a little overkill, but we may need to get there, and we'll may need to do another video on that for her. But I think this will actually do. So after I'm done with my energy treatments, which is Morpheus RF, Agnes RF, Secret RF, face tight, then what we can do is put some threads. The threads that we use primarily is the axle thread, so the 18 gauge axle thread on the Master Trainer. It's FDA approved from South Korea. I love it, especially for younger folks, for anybody, because they're not loaded. So when you put the threads, glides in very nice and smooth. I can do some threads for her in 10 minutes actually, but we're not yet, okay? So with the threads, we go pull the jawline under and in that area, and that's gonna be a slam dunk, usually for older folks, not somebody at age 26. So this is just all probably she needs, and this is gonna do it, and we will send you guys some updates with before afters at some point. Just check our website, pchmedspa.com, and Instagram, PCH MedSpa. Hallelujah, have a great day. Hey folks, Dr. K with here with our beautiful model Kaylee, and she did the Morpheus8 for the under jaw and neck area, just tighten skin, some fat destruction, and this we did more than 700 clicks, folks. See how this looks, and she's got very white complexion, and you can see it's really not bad. Just some
Not bad
redness,
at all.
yeah. And guess what? We're gonna do the red light therapy for her so she can recover sooner. Awesome.
Yep.
Hey folks, we're back. We just did the Morpheus, so our clients have the luxury of get the red light therapy, LED therapy after their sessions. It's gonna stimulate your skin. It's gonna make your skin make more collagen, elastin. It stimulates the fibroblasts, okay? So that's what the red light does. It stimulates your good cells, which are really the fibroblasts. This red light has a penetration of 630 to 690 nanometers, so it goes to a kind of a deeper plane. But with this beautiful machine that we have, we also have, you can come here, Corey, and show basically the settings. See, we do have orange light, we have blue, we have the white. So blue is a little bit more superficial. It's good for basically rehabbing the skin. Also good for acne, for inflammation. And you do have the orange, which is good for allergies, urticaria, hives, and things like that. And then you have the white, which is a more of a wide spectrum. and you really gives you the most for your bucks. But for her, red light therapy is all she needs. We can do 20-30 minute session. It really does help. And the patients that we do that get packages, they have the privilege to come here and get this treatment once a week for free, and it's just a nice addition to things we do. All right, how you doing, Haley?
Great.
Woohoo!